Hello, my name is Dr. Scott Young, and today we're going to talk to you about the 3 ideas that a person with hearing loss should consider in wearing their hearing aids. Coming right up. Okay, so you're at this place where you're wearing your hearing aids for the first time. I want to tell you about 3 different questions that keep coming up. Number 1, should I wear my hearing aids all the time? This is a very, very common question. Some audiologists and dispensers try to tell you just wear it a little bit at a time and build up your tolerance. Incorrect. Now, as a person who wears hearing aids and has worn them for a long time, 9, almost 10 years, with my mild to moderate hearing loss, I tell people exactly what I've done as well. The reality is that you should put them on in the morning and take them off at night. Now, most people are up 12 to 14, 16 hours a day. Wear them all day long. Now, if you, like some people, will sit in bed and read with your wife or husband or whatever, and you like to read or you get on your iPad at night, whatever that might be, well, maybe you take off your hearing aids in that circumstance. But you should be wearing it all day long. And that helps you get used to the sound. So I want to tell you about something that a psychologist kind of came up with years and years ago. I want you to think about a closet. So right here is our closet, and it's got all the clothes all over the place. And it's so disorganized. How do you deal with a closet? First off, you take every bit of the clothing out, you got your hangers up, and you take out every piece of clothing, and then you start to organize it. Maybe you're organizing it by color, type, whatever that is. And you're looking at each piece of clothing that you're going to put in the closet. That's the same thing that happens with a patient who's wearing hearing aids for the first time. They need to listen to each sound. So let me tell you what happens. I had a guy that said, I couldn't stand the microwave. Well, he's got to get used to that microwave sound. That's a normal thing. He's got to listen to the sound and say, oh, that's what it sounds like. Now, if he wants to have a better microwave, that might help him out or whatever. But the reality is that's that sound. That's just what that sound makes. Now, we can adjust for that to help take care of that a little bit better. But the reality is there are sounds that the world makes. One of the funniest patients I ever had, we have this a part of our driveway at 6550 East 71st Street. And I don't know why this happened, but a fire truck with his sirens comes into the parking lot and decides to flip a U-ey. And so I have this patient, and we put on their hearing aids, I walk her outside. I always show the background noise. These are just some real world tricks, and we do a whole bunch of other things to verify the fittings, including real ear issues. But I really like to use real world issues on top of that. So I put her out in the real world, she's listening to this, and she just starts, oh. And I look behind her, and there's a fire truck. She goes, oh, I can't stand it. I know. Because that fire truck is maybe 115 decibels. Those are just realities to the world. Number 2, why does my voice sound so weird? Well, it's called occlusion effect. O-C-C-L-U-D-E-D. Occluded. When you have occlusion or you're occluded in your ears, you're feeling plugged up. Now, customized hearing aids have a potential for a higher level of occlusion depending upon that hearing loss. So when you have this occlusion effect, how long does it take? Well, again, wear it consistently throughout that first couple weeks, and you will notice that the occlusion effect will reduce. Now, if it's not fixing it, there are several things that an audiologist should be able to do for you. There are adjustments to the shell of it. That's something that we do. There are adjustments to the sound of it. Something that we can do. But your job is to wear it consistently because you've got to get your mind tuned in. Think about this. Back in the 70s, when you had the channels and your TV, and there was this UHF channels, and you would tune it like this to get the exact right channel. Or if you were in your car and the AM radio and you would tune your radio exactly on. That's exactly the same idea that happens when a person is wearing hearing aids for the first time. They're tuning into the world. So I've just told you about organizing your closet, and we've also talked about that occlusion effect. Now, receiver in the canals that have a little bit more of an open effect can have a microphony, like Mr. Microphone sound. And that's a very normal thing, but it takes a few days to a week or so to get used to that Mr. Microphony effect. It's totally normal. Don't get bothered with that. That's reality. Happens to me as well. And thirdly, what do you do when you have these big box stores? Okay, there are big box stores that try to sell hearing aids to people. And I want to give you just two cases that they can't possibly do. So Fran comes in and she has a very old cell phone. Now we hook her hearing aids up for her cell phone. And it's a very old phone, and it barely works to control her hearing aids. And she comes back a couple times saying, this is not working. I'm like, Fran, your phone is the problem. And she goes, I know, but you know what I did? I went the extra step by getting her a remote control and say, well, you can at least do some of the features through the remote control. She's like, wow, that's amazing. I mean, you worked so hard. I gave her my text message so she could call me or text me and tell me what's going on. That's something that the big box stores can't possibly do. That's something that the online places can't do. Another gentleman came in, and Rick he is a commercial real estate agent. And Rick comes in with his slightly older iPhone. Now, it works a lot better than Fran's, okay? But with his slightly older iPhone, there were a lot of weird things. When I set up the app for his hearing aids, and we used Resound at the time, and when I set up the app, I mean, his phone was doing nutty things through the app, and I couldn't figure it out. So I had to spend time, research it. I spent an extra 30 minutes researching and calling and figuring out, and realized that he had more than 500 Safari websites up that were affecting his app. I spent time clearing out the app and doing a hard reset. Once we did all that stuff, I brought it back and he's like, wow, no one else does that. That's because private practice audiologists, private practice dispensers can spend more time than those big box stores. So if you have a problem with your hearing, give us a call, because that's exactly what we do. We spend time and identify your exact needs. That's what we do every single day, and we're happy to do that. So share this with your friends, tell us about it, give us a call. You can go and see our website at heartulsa.com, but subscribe and check us out. Thank you so much.